My name is Faith Blanchard-Ludanga. I attend the University of Tennessee Health Science Center in Memphis, Tennessee. Getting into college and obtaining my DPT means an opportunity to be able to help within my community. It's important to me to have the skills to be able to do something about some of the challenges, particularly physical challenges that I see within my community. And also just having access in a network to be able to also bring other resources within the health field to people who have challenges accessing it. So that's what it means to me. So there have been several experiences in my life that have uh, driven me toward physical therapy. I can share a couple of them. One of them was with my mom. My mom is a disabled veteran, and she has had chronic back pain since I can remember. And my senior year in high school, it got so bad that she couldn't stand up for more than 5 minutes. She was so frustrated and just getting very discouraged because all of the doctors she went to didn't have answers. And so, like, unfortunately, as a last ditch effort, she was prescribed physical therapy. And I just remember the first time we went to see her physical therapist. I still remember her name too. And the therapist listened and made my mom smile and encouraged her. And well, it was the first time in a while that I saw my mom have hope about her condition. And then also more recently, what really solidified me coming in jumping back into school after quite of a break was after having my first child overseas and seeing just the difficulties that other people go through that we are not used to seeing. For example, within the time my son was born, about two or three women and several children just lost their lives to things that could have been avoided. So it challenged me because I have this opportunity. I've been accepted into physical therapy school and I have the capacity. I've been blessed with a brain that can take in all of this information. So what was I going to do about it? So that's what really encouraged me and challenged me to jump into physical therapy school. And I'm really thankful that I did. I could talk a long time about my university, the UTHSC, the one in Tennessee, not in Texas. So the reason I chose UT was because one of my main criteria when choosing schools, even when I was in college, was feeling like I could be a human there. So college on any level is just, it can so easily be a stressful, competitive environment, rightfully so. But it was important for me to be in a space where I felt like I had the margin to do things outside of the classroom, whether that's service or hanging out with friends, or like whether I have a bad day and I'm not able to get my work done, and having that the ability to talk to my professors about that and be honest and say I tried and I couldn't do it. It it's I'm not perfect, and that became very much more important after having children and babies getting sick and the daycare is closed and all of the things that come up just in life. So when I came and visited UT, I was very much impressed by how personable the staff and the faculty was. And still, like, I just have so many stories. It's not easy being in school with children, and they have really embraced me and accepted all of me and all of my mess. And like, there have been times where my professor has had to hold my son because the daycare's closed and I have a practical that day, or had to figure out how to arrange to record the lecture because I can't be in class. Like, I had my second child in the middle of my first year, so there was a lot of arranging around that, and they've always been encouraging. And even when I have felt like, I don't know if this is still possible, telling me, no, it's still possible. So I love my school, and it's been such a gift to find a place, a school that's a school and a challenging academic program, but also a family that understands what it means to have a bad day. One lesson that has stuck with me was one comment that my one of my professors made was, there's a difference between practicing and having a skill set. And I really started to understand what that meant after going on my first clinical rotation and realizing that I do not have the skill set yet, which is fine. But it helped me understand the importance of what my professors always emphasize, being a lifelong learner, having that desire to keep learning, to keep up to date in the field as things change and as new things are understood, having the network for those situations where I can't figure it out and need to refer or need to ask questions, having mentors within the field. I really started to understand that for the duration of my career, I'm going to be a student, and that I won't learn everything in the 3 years that I need to know if I really want to be an excellent practitioner. I remember when I first started clinicals and just feeling like a fish out of water, and like not knowing where to start with patients, just having a lot of fear, honestly. And then the first time that I was like, okay, I can do this, and starting to really feel like a physical therapist. I had a patient who had ankle pain, and I had worked with her a few times. And then there was one day that my CI, clinical instructor, gave me time to research. And so I sat down and I did some research based off of what she had shared with me about things that she said in the past that had helped her pain, things that exacerbated her pain, and looked up some interventions. And so asked my CI, and he allowed me to uh, work with her and try the things that I had done a little research about. And this doesn't always happen, but as I'm doing the intervention, she's like, "Oh, that feels so much better." And literally, I just couldn't stop smiling because I was like, and I looked over at one of my CIs, and he just smiled back at me because it was like, okay, this is what it means to have a skill, knowing what to do and where to go to without having to have a lot of test trials, because you have practiced enough and you have asked the right questions. And that's awesome. You'll be saving yourself time, you'll be saving your patient time and money. So that has really stuck with me, and has even encouraged me in the classes and the long hours, that the purpose of this is to be a skilled practitioner. I have been surprised within my DPT program with just how quickly we start practicing and getting our hands on patients, and that the things that we learn so quickly translate into into helpful interventions. And it's pretty awesome to be able to see the fruit of all of the hours of studying pay off. Like, that we're not having any wasted time or useless classes. Like, everything is directed toward getting us ready to be entry level physical therapists. And during my first clinical, it was just awesome to be able to learn from my CI, but also uh, be able to share with him the new things I've learned and contribute also to his practice. So that was the surprise to me. I really expected to be more of an observer, but even my professors and my CI, they're so encouraging in wanting us to be a part of the field as much as we can be at our level. So that's been the surprise for me. So I have two areas of specialty that I'm interested in within physical therapy. One is pediatrics, and the other is pelvic health. Really, I'm interested in mamas and babies, and so I love babies. I just love children. I've worked with children in several capacities, and I have my own, and so I think it's really amazing to be able to really impact a person's life at such an early age and really change the course of what they'll be able to do in the future. And also, pelvic health is something that I've just recently been introduced to, and I was I had to see a pelvic health therapist myself after having my second child, and just realizing how important that is, especially for mothers, because there's just a lot of pain and discomfort that comes with childbirth and delivery and then postpartum that is expected, and realizing that it doesn't have to be that way. That there are things that can be done about the pain that mothers are often have. So those are my two areas that I'm really interested in pursuing in the future. I learned about Rising Tide through an email that our director sent to our class. And so I went to the website and looked just through the previous recipients, through the mission statement and the vision, through the board members and what they do in their lives and what they've accomplished. And I was just like amazed, slightly intimidated, and knew I wanted to just try and be a part of what Rising Tide is doing. My advice to future applicants is to just be yourself. Look through the website, see if the vision of Rising Tide is something you really want to be a part of, because it is, of course, an amazing financial scholarship, but it's also uh, an opportunity to be a part of a community and a network. And so I would just suggest seeing if you align with that and be yourself in what you write, and in your interview, share your story. It's not very complicated, and it's not overwhelming, or like they're going to ask you a bunch of serious questions with right or wrong answers, but they're just trying to get to know you. So that's my advice. And also, don't don't look down on what you have to offer. I think that was my fear in the process after seeing previous recipients. I'm like, can I, do I have enough to qualify? And so just be confident in who you are and what you have to offer. I am most excited about really getting involved in the Rising Tide community and just seeing how we grow together in the future in our professions, and being able to have people that I know I can call on if I need to or want to. And I look forward to the times of meeting everybody at our meetings, our yearly meetings. And in the future, this is one of my goals in physical therapy school. We had to make mission statements our first year. And one of my major goals is to build a strong network because I really want to be able to help further my community and the health outcomes in my community as much as possible. And I know I can't do that alone. I'm just one person, one physical therapist. I don't have all the skills, but if I'm connected to people who have different skill sets than I do, who know other people that I don't know, who have resources that I don't have, then I'll be better equipped to help my community and just to be an awesome physical therapist. So I really look forward to seeing the amazing people in Rising Tide come alongside me in my journey and help me to be as beneficial as possible to my community in the future.